It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. Thank you so much for joining us today. And we just want you to know we are very passionate about natural approaches to health. And you can always go to hotzepodcast.com. That's Hotze podcast.com to download our latest and greatest podcast. Now, today we have Dr. Al Johnson, and he is an expert in hyperbaric oxygen therapy, which is a topic that's always fascinated me. So I am personally interested to hear more about it. Aren't you, Dr. Hotze?
I sure am, and I want to thank each one of you for joining us today on Dr. Hotze's Wellness Revolution. Yes, we're leading a wellness revolution around this country, trying to help individuals like yourself to get on a path of health and wellness naturally. So as you mature, you got energy, vitality, and enthusiasm for life without using pharmaceutical drugs, which are toxins and poison you. We have today on our program, again, a returning guest, Dr. Al Johnson. Dr. Johnson has the Johnson Medical Associate Center in Richardson, which is a suburb of Dallas, Texas. He also is the owner of the Hyperbaric Oxygen Chamber Center of Texas, which is the largest hyperbaric oxygen chamber center in the state of Texas. He has 5 premier units there and is an expert in the use of hyperbaric oxygen for the treatment of a multitude of various medical conditions. Thank you for joining us today, Dr. Johnson.
Welcome.
Thank you. I'm privileged to be here.
Well, listen, let's talk about hyperbaric oxygen. I'm sure many people in our audience have heard about that, and we think about it usually in the terms of divers in the sea. When they get the bends, they take them out and they put them in a hyperbaric oxygen chamber to keep them from or to resolve their problems with the bends. But I know it's used you use it in a multitude of medical conditions. So tell us, what is hyperbaric oxygen? Describe that to our listening audience.
Well, hyperbaric oxygen treatment is when a person is placed in a chamber breathing 100% oxygen that's pressurized. The pressure then saturates the whole blood vessel so that the whole blood vessel carries oxygen, just not hemoglobin, to the tissues.
When you say the whole blood vessel, does it saturate the white cells and plasma cells and red blood cells, all of them?
Yeah, it saturates the liquid plus the cells.
Right.
In the blood vessels. And so you get a delivery of 10 times to 15 times normal to tissues. Tissues need 2 things to heal. They need oxygen and they need glucose. And so tissues that have been damaged from whatever reason, hyperbaric oxygen can help the healing process in. So you're talking about the bends. What happens there, the body traps nitrogen and causes bubbles in the joints and in your brain and so forth, and can cause damage. Oxygen washes out the nitrogen, and that's how it works for the bends. For other disease processes, whether it's been sports injuries where you get tissue injuries and swelling, or whether it's head trauma like concussions or stroke, or degeneration of tissues from neurological diseases, oxygen helps the healing in those disease processes and helps with recovery.
Yeah, let me go down this list of what you treat, what you use your hyperbaric oxygen chamber for autistic children, for burns, cerebral palsy, chronic fatigue syndrome, closed head injuries, concussion, dementia, fibromyalgia, post-traumatic stress disorders, migraines, multiple sclerosis, near drownings, Parkinson's syndromes, osteomyelitis, sports injuries, strokes, and encephalopathy are just some of the conditions. Besides, you also use it in the treatment of mold toxicity. I know that. and in infections. So, and people, for instance, people that have diabetes oftentimes will get infections on their distal extremities that become gangrenous, and it's also used to help treat that. And so you use it for a multitude. Now, you've had a multitude of medical conditions. You've had the Hyperbaric Oxygen Treatment Center there at your medical center for how many years?
15 years.
Okay. And what was it that led you to develop an interest in the treatment of diseases using hyperbaric oxygen?
Well, initially, being an environmental physician, I was seeing people with toxic exposures to like solvents, benzene, toluene, pesticides, and they were getting neurological symptoms from them, and there's no medicine out there to treat these people with. And so I started looking at the literature and found, hyperbaric. I knew about hyperbaric in the bends and hyperbaric in wound healing. And then I started seeing from the world literature, they're using it around the world for a whole host of other types of problems where there was cells were damaged either from toxic exposures, from strokes, and like you mentioned, and got 2 chambers to start with. Started treating these people that were having neurological problems, and they started to recover and respond well. And so that's how I really got started, trying to figure out how to treat these people that were given no hope for recovery after their toxic exposure.
Well, tell us now, at your center, on an average, you're open 6 days a week, Monday through Saturday. How many treatments will you normally perform in a day's work there?
I don't know, say 40, we can get 40 to 50 hours of hyperbaric treatments. So that's, 40 people or 30 people, depends on whether they do 60 or 90-minute treatments.
Right. And that's per week or per day?
That's per day.
Per day, 40 or 50. That's a lot. Mm-hmm. And this is why I brought Dr. Johnson on the podcast. He is a world expert in hyperbaric oxygen therapy for numerous different problems, and people come from all over the world for treatment there. Now, one treatment with an hour in the hyperbaric oxygen chamber, and when we say hyperbaric, folks, that means under pressure. How many times altitude pressure would you have in a normal hyperbaric chamber when you're treating?
Yes, we have the hard-sided true hyperbaric chambers here in the clinic. Just so the listeners understand, there are high mountain rescue bags or soft-sided chambers, which some health wellness type centers have, where you breathe oxygen. The bags go to 1.3 atmospheres, which is about 10 feet underwater. They may be a little help, but when we got true disease processes going on, we need more pressure with a true 100% oxygen delivery to get fairly rapid recovery. So when you're talking about atmospheres, we're on Earth are at 1 atmosphere. If you go to 33 feet underwater is 2 atmospheres. So we're start treatment at about 15 feet underwater, which is 1.5 atmospheres. And then you go up to 2.4 or in some cases 3 atmospheres if you're treating the bends.
I have got you on that. That's so when we say hyperbaric, we means hyper means increased. Baric has to do with the pressure, so it's increased oxygen pressure. Remember, air, folks, has weight, and as when we stand at sea level, there's 1 atmosphere. I don't know what it is at 5,000 feet or 1 mile high in Denver. I don't know what the atmospheric pressure is, but it's going to be less because it's a higher altitude. And the higher you go, you have the less oxygen, less air, so it has less pressure on it. Literally, the air that's around us that we can't see but we breathe, it's got weight to it. It's weight, it's molecules. And so what they do with hyperbaric chambers is they increase the pressure, so they drive the oxygen into the blood, all the blood, the serum, so it increases the amount of oxygen in your tissues by I guess up 10 times. How high can you get the oxygen in the tissue up? 10 times or more?
Yeah, it increases the tissue oxygenation about 10 times.
So, and the oxygen, of course, is needed in the mitochondria, which is your power plants in your cells, to enable your cells to generate electrical energy in the form of ATP or electrons, which drive all the biochemical processes. So, if you're toxic, or if you've had damage and you're not getting enough blood flow to areas where you've been injured, your tissues aren't going to heal well. But that's why we use the hyperbaric chambers. Now, in the routine problem, let's say somebody's had a stroke, or say somebody's got a wound that isn't healing. How many treatments is it going to take? Or mold toxicity, and I know it's going to vary by various disease processes. How many treatments and how often will they have to take a treatment?
It works like physical medicine, rehab, exercise. It builds up over time, so it's a healing process. Usually if you have a stroke, it takes like 40 hours of hyperbaric. Now, you don't do that all at once. You do an hour to hour and a half a day, maybe 2 hours a day, and do that for 20 days to get those tissues that have been damaged by the stroke but are not dead alive, starting to work. So it takes 20 to 30 hours to really get those cells moving, healing themselves with the hyperbaric oxygen. So typically we look at sessions of 40 hours to get healing processes done. Now, that's not always the case. Like in concussions, acute concussion, there's recent studies that show that within using daily 1 hour of hyperbaric for 3 days, that 80% of the people that had concussion symptoms, their symptoms were resolved. When on the average with just rest, the average is 17 days recovery, and there's 20% that have symptoms longer than 30 days. So there's a lot of benefit that can be achieved with the concussed person, with the stroke person. In a lot of the foreign countries, they'll treat stroke with hyperbaric first to get the cells working, and then do stroke rehab second after that, so they have some good cells to actually work with. Here in the United States, they try stroke rehab first, but the cells aren't healed, and so you're working with a faulty system, the brain, and so I see them a lot of times afterwards, and they say, man, I've been trying to get my coordination or my speech or my vision better, and it's just not working well. It's really slow. We put them in hyperbaric. It speeds that whole process up dramatically.
Well, Dr. Johnson, this is very fascinating, and you're doing a tremendous work up there, helping so many people, and very few people are really aware, including physicians.
Absolutely.
Are unaware of the benefits of hyperbaric oxygen treatment. And so tell us how anybody in the listening audience could get in touch with you if they want to be evaluated at your center there in Dallas, the Richardson, which is a suburb of Dallas. How would they get in touch with you?
Well, you can call my office at 972-479-0400, or you can go online and Google johnsonmedicalassociates.com, and there's a place in there to respond, or Hyperbaric Centers of Texas, and it tells you all about hyperbaric, different modalities we treat, the different diseases, the different injuries, has testimonials, which is good information for someone to learn more about hyperbaric.
Well, we want to thank you so much for joining us and introducing this very fascinating treatment modality, hyperbaric oxygen therapy, to our listening audience, and we congratulate you for the success that you've had in developing the largest and most comprehensive hyperbaric oxygen center in the state of Texas. Thank you so much for joining us,
Yes,
Dr.
thank
Johnson.
you.
Thank you. My privilege.
And if you all would like to know how you can get healthy and well naturally through the services that we offer at our center and learn more about that, then you can give us a call at 281-698-8698. That's 281-698-8698. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.